For DVT prophylaxis after partial knee resurfacing, our stress level is much lower than when we do total knee replacement because the bleeding is a lot less and the surgical intervention is a lot less. So the typical patient is placed on aspirin for 3 to 6 weeks, but we customize it for risk factors, medical comorbidities. Certainly if someone has atrial fibrillation or another need to be on an anticoagulant, we do use Coumadin, but for our standard patient who doesn't have risks above normal for DVT, we use aspirin, which is much easier on the system and allows for a quicker recovery with less bleeding complications after such procedures. Postoperatively, one of the main concerns that we have is infection. The most common infection we see is just a simple skin infection or a cellulitis, which is just treated with oral antibiotics. In order to prevent or decrease the likelihood of that, I send patients home with 5 to 7 days of an antibiotic taken orally just to prevent the superficial skin from developing any kind of infection. The major concern that we want to prevent is deep infection, which requires more surgery to clear that infection. And with less surgery, with partial knee resurfacing done in an ambulatory setting, this complication has been lowered dramatically. We use antibiotics at the time of the surgery given intravenously, and it's been found to be a very safe procedure with very low risk for infection. We are always checking the wound. We utilize physical therapy as well as nursing to check the wound with us, to report to us, and so with this very focused postoperative regime, we've had an extremely high success rate at Optum Surgical.